is a very dynamic, interesting, exciting time with extraordinary potential, because health information technology gives us the same kind of power to understand the consequences of what we do and our new opportunities to do things that it has given to every other sector of the economy where it has been broadly and deeply adopted.
This country has to deal with the healthcare challenges that we're facing. And I think that we have seen in the national campaign, whether you're a Democrat or Republican, we have candidates that have talked about it and are concerned about it, and they have, no matter from which vantage point they're coming from, all indicated this would be a high priority in the next administration. And we are prepared, Senator Enzi and I and our committee is prepared to be a constructive and positive and to try and find a common ground in this area as we have in other public policy areas.
Marshfield Clinic really has leveraged our information technology to help improve the care for our patients. And one example is we use an application that we developed called the Patient Dashboard. And what we're able to do is we have our tablet computer in our hands before we walk in the exam room with the patient, and are able to view several different panes of information that's sort of the condensed version of the patient's electronic medical record, and able to quickly see what their diagnoses are, their vital signs, medications, allergies, and other information, so that you have a real encapsulated summary of that patient before you walk in the room with them.
Health IT truly is a national issue, and leadership at the federal level is essential, and that's why we're here today calling on Congress to move forward on this important issue. I stand ready to work with my fellow governors to do all we can to set up this important electronic infrastructure necessary to meet the needs of every American.
With Health IT, parents will no longer have to visit a doctor's office to get vaccination and other records for their kids' schools and summer camps.
With having all the information encoded electronically, that gets put into our data warehouse, but we're then able to retrieve it using these different applications and getting back the information to the doctor, really the pieces of information that they need. And so it really helps us to track and to monitor and really try to improve the outcomes for our patients.
Health IT will allow doctors to review vital information with no gaps. We will be able to better track and treat disease outbreaks during disasters, such as Hurricane Katrina. And medical workers will be able to instantly retrieve records for emergency treatment.
It's really about patient safety, it's about saving money, and it's about the quality of care for the people of America who rely on healthcare professionals and who need care at affordable costs. Our Department of Health and Human Services has reported that the adoption of Health IT could cut healthcare costs by 30%. Most of all, it's claimed that Health IT might save literally thousands of lives every year. Now, how might it save these lives? Well, in today's antiquated paper-based medical record system, healthcare providers need to struggle to make sure that they have their patients' latest, accurate, and fully complete medical records. Too often they don't. Inaccurate information contributes to an estimated 98,000 deaths that occur each year because of medical errors.
We live in an information age, but that our healthcare system remains mired in a pen and paper past. We have 90% of doctors, 80% of hospitals still use paper records.
When you introduce IT into a whole industry like this, you're looking at somewhere between 20 and 40% savings in administrative costs and improvement in quality of treatment of customers.
Incredibly, about 85% of all doctors are still operating the horse and buggy days, paper and pencil now. Just in one hospital in Washington, D.C., shifted to electronic medical records, they saved over $3 million. Proportionally, if you look at that, that's a minimum of $81 billion nationwide, $23 billion just in Medicare alone. So there's some tremendous values for all of us there that we can continue to give better care.
Absolutely no way that we can continue to benefit from the explosion of medical knowledge that can improve quality and care without health information technology.
This fundamentally is about really improving the quality of care that citizens in America receive so that they're getting access to really the state-of-the-art and the decision science that physicians really have available to them.
So we're urging Congress, we'll be going to the Hill, to urge them now to act as quickly as possible for the need of all Americans, and I think it'll be a great value.